Millions of Americans face the same problem, walking into a doctor's office or hospital only to get an unexpected bill. Don't even get me started on this. That bill, weeks later, it's exorbitant. As healthcare costs climb, surprise medical billing is becoming more common, even with insurance and research. Finding clear prices really can be overwhelming. And then when you call to try to find out beforehand, nobody knows. You know what I mean? Yeah. ABC's Olivia Rubin reports on the issue and what you can do to better navigate your health care.
The healthcare industry can be a maze to navigate for consumers. Even with certain protections, patients often have no way of knowing what they'll be charged.
In the United States, our system is designed for profit.
A system where prices are often hidden and the true cost is revealed after the visit. Medical bills for hundreds, if not thousands of dollars aren't unheard of. What you initially thought was a manageable bill can skyrocket. Nearly 60% of adults reported a problem with their health insurance in the past year, a number that increased to nearly 80% for those who saw a provider more than 10 times.
It is a huge problem in our healthcare system, even with certain protections in, legislation that's been passed. There are many holes in the Swiss cheese, if you will.
The No Surprises Act protects people from surprise emergency medical bills, from out-of-pocket network providers at in-network facilities, and from out-of-network emergency medical services. But it doesn't apply to non-emergency regular office visits or hospitals. A provision called the Advanced Explanation of Benefits, or AEOB, would require transparency before a visit, but it hasn't been implemented. Experts say protecting yourself starts with checking your insurance coverage, getting approval for a procedure ahead of time if required, and speaking with the billing department at your doctor's office to discuss possible scenarios. Finding a doctor who accepts your insurance is a good step, but consider deductibles and the portion of the bill you are responsible for. Hospitals are required to list estimates of common procedures on their websites and update them annually. If your insurance refuses to cover treatment you think is necessary, you can appeal, first to the insurance company's appeal process, then to a government agency or independent medical expert. You may even have luck if you appeal to your specific company's insurance representative.
Know what an explanation of benefits is, how to read it. So you know the right questions to ask when you see a number on a bill that doesn't make any sense.
If something stands out,
it is possible to get some charges changed, and there may be errors. This system isn't perfect. You may catch something that you really shouldn't need to pay for. And if you don't ask about it, that's money that's lost out of pocket.
There are also consumer assistance organizations around the country that can help navigate this system. Some are free while others charge a fee. Olivia Rubin, ABC News, New York.